There is a question of a child not necessarily related to this condition. Some guidance for a child who had burns for 50% of the body, was in hospital for 60 days with multiple surgeries and is now discharged, has severe itching and some flexibility issue. This is a case of like burn injuries and is now discharged. Because there is flexibility issues also. Maybe a standard Pitahara line of treatment would be appropriate here, sir. Gururaja, sir, please.
Very clearly, the patient has burns up to 50% of the body, now recovered after multiple surgeries. We don't know the exact areas involved. And usually, if limbs are burnt and if these type of things are there, then there is chances of strictures formations, and there will be flexibility issues and itching, maybe because of some glands are producing the sweat and trying to keep the moisture of the skin might have been lost. That's why there is a dryness and itching and so many things. So in these cases, what we can do is simply we can go for, if the patient could be able to tolerate the thing, then we can go for Murivenna Tailadhara or even Mahanarayana Tailadhara, and application some gels containing Kumari, aloe vera.
So just in the case of burns injury, more than 50% burn, what we actually do in hospital is Vran Dhupana we give. Vran Dhupana with Neem Chal, Khadir, Vidang and Yashti Madhu, and sometimes Shiris also to remove the toxicity in the skin. So this also works very good, followed by Panchvalkal Kwatha wash.
But this is when you're treating the wounds, correct? It's not when
Yes. But it will still have case is discharged, but still some effect is still there. Flexibility issue and all.
Yeah, and I've seen some references where Panchavalkala Kwata is used as a liquid for preparing Shatadauta Grita. So, but Dhupana as such can be little pitta aggravating and would cause increase of burning sensation.
No, it won't. Actually, we thought like that, but while doing, we don't face such issue.
Okay, and for how many days would you recommend Ranadupana?
No, that depends on area and severity. Usually for 3 to 5 minutes, thrice a day we give.
Do you mean Vranadupana can be given if we can consider even the burns or the whatever cares have been left over after the burns, if we can classify them as Sama and Nirama again?
Yes, sir. It will, because in Sushruta, Dagda Vrana is there. Vrana Upkrama, so many Vrana Upkrama, Sushruta has mentioned. In that, for Dagda Vrana also, he has mentioned Dhupana. Dagda Vrana is burns wound.
Like Dhupana, you would prefer when there is some oozing or secretions and discharges, and if it is totally dry, you will go with Kshiradhara and also Sneha application as Gururaja sir has mentioned.
In dry also, Shirisha is told as Vishagna, Agre Dravya. So simple Shirish, the Shirish Panchang Dhupana also we give to remove the septicemia, or it will prevent further septicemia if we give continuous Shirish Dhupana over the skin.
My understanding is that whenever there is an immediate burn, a fresh wound is there, burn is there, then Panchavalkala Kwata, Prakshalana and even such type of Dhupana, all those things, in order to overcome avoiding the infection and their complications. But here case is already treated and it is discharged from the hospital and complaining of itching and flexibility issues. I think the wound might have been healed very well. Only thing is that is the complications of the burns. Now we are trying to do it here in order to avoid that flexibility issue and itching. Both are due to Vata. In order to nullify the effect of Vata, we need to go for the Taila Dhara, and it will be more prominently, we could make it containing anything like Mahanarayana or Murivenna Taila Dhara. That will be beneficial. But whenever there is a fresh wound and there is a oozing and that type of thing, then Panchavalkala Kwata is used, as well as even Vranadupana can be done. That will be fantastic.